Good evening, ladies and gentlemen. I'm Bill Clifford, President and CEO of the World Affairs Councils of America, and it's my pleasure to welcome you to this opening keynote session and the presentation of our International Service Award for 2020 this evening at the WACA 2020 National Conference, New Frontiers in Diplomacy and National Security. I'm delighted to have a national audience and even with our international partners coming in for this event, where we're so pleased to welcome Dr. Ngozi Okonjo-Iweala, who is the chair of the board of Gavi, the Vaccine Alliance. I will introduce Dr. Okonjo-Iweala momentarily. First, I would like to thank all of you for coming. I want to thank especially the WACA National Board of Directors, which has provided extensive support for this national conference, and our earlier endeavor this fall, the Conversations with C-Suite CEO Forum. In addition, my great national staff of Liz Brailsford and Laura Duncan, along with our interns, Ranika, Soha, and Kimberly, have also supported this event, and we will be bringing this virtual conference to you all week. A great set of programs and leadership workshops for your learning pleasure, your conversations, and your professional development. And last but not least, we wouldn't be able to do this without the generous support of our sponsors, in particular, Carlos and Malu Alvarez. Carlos serves on the national board, and his company, Gambrinus, has been a terrific supporter of the national conference for well over a decade. Our friends at the Embassy of the State of Qatar have engaged with us in a variety of programs, and including sponsoring this event. Philip Morris International, Korea Foundation, Johnson & Sterling, our other major sponsors. We thank them for their generosity. Global Ties US, Daily Chatter, Foreign Policy Association, all these friends and organizations which we engage with over the course of the year, and especially this week, our thanks to you. Tonight, I am so pleased to welcome Dr. Ngozi Okonjo-Iweala, Board Chair of Gavi, the Vaccine Alliance. She's a development economist and former finance minister of Nigeria, who has had a 30-year career in development and financial matters in governance, both of cabinet level and international organization. She is also, as many of you have been reading, a finalist to be the next Director General of the World Trade Organization. In serving as Nigeria's finance minister in the early aughts, she cut $30 billion of debt to the Paris Club of Nations, a major accomplishment. She has also, in 2006, served as Nigeria's foreign minister and held several key positions at the World Bank, including as managing director, and she serves on the board of Twitter and also the board of Standard Chartered Bank PLC. In April 2020, Dr. Okonjo-Iweala, she was appointed an African Union Special Envoy for COVID, and also she was appointed World Health Organization Special Envoy for the Access to COVID-19 Tools Accelerator. I could go on about her many awards, accomplishments, achievements, and honors. We will honor her later tonight, but it's most important to welcome you, Ngozi, to this conversation with our national network and to talk about the incredible place the world finds itself in today. Here in this country, we are nearing 250,000 deaths from COVID. Worldwide, we're in the millions, and there seems to be no end in sight to this scourge. The US and the world were caught by surprise by the COVID-19 pandemic despite years of planning and warnings, and yet we haven't succeeded. Why is that? What explains the lack of preparedness and execution on this terrible global pandemic?
Well, thank you so much, Bill. It's a pleasure and an honor to be with you all, and with a pleasure and an honor to be with your audience. You know, the lack of preparedness really caught everyone by surprise. And what was interesting, if you talk to people from developing countries that have weak health systems, are usually not as prepared, they were also surprised that the rich countries also were not really prepared and suffered from some weaknesses in their health systems that was unable to cope with the scale of the pandemic. And one has been mulling over, why were we not prepared? I mean, there was some warning. Some years ago, Bill Gates clearly talked about the fact that there would be pandemics down the line. And as I think through it, it's probably because the experiences we've had with epidemics and pandemics have not been as severe as anything close to what we're experiencing now. And maybe that is why the world was not prepared. Please remember that when we had SARS in 2003, yes, it spread, I think, from the Americas to a few other parts of the world, but it didn't result, I think it resulted in something like almost 9,000 deaths at that time, and it was contained within 6 months. We also had the MERS epidemic, which was confined to the Middle East, started in Jordan, but mainly stayed in the Middle East and resulted in 858 deaths. Actually, I'm sorry, the SARS resulted in 774 deaths, about 9,000 cases, 774 deaths. MERS was 858 deaths. So you can see, and then we went to the H1n1 epidemic in 2009. And even that, which was it was a pandemic. It was eventually ruled a pandemic by the WHO, but that also resulted in 18,449 deaths. And so you have the SARS being confined to mainly Asia, MERS being confined to mainly Middle East. H1n1 started in the Americas and spread to some other countries, 18,000 deaths. So I think the ability earlier on to contain some of these epidemics and pandemics relatively quickly and to manage them may have lulled us into thinking that, look, this happens only in some parts of the world. We don't have to worry. And even if it comes to our part, we can deal with it fairly quickly. There was also Ebola in Africa, but that was also a regional thing. So I think that may have lulled us into a sense of we can handle this. The second thing is that, at the time some of these epidemics and pandemics occurred, there was more cooperation. The sense of multilateralism and we are in it together, I think, was much more profound. And there was strong cooperation with the WHO, with the US took leadership in some of these. And so this feeling that we're all in it together and we could contain it, this strength of multilateralism, I think, was very helpful to also supporting the WHO to act. And as I look now and see that some of these ingredients are lacking, perhaps we all laid back, we are not as cooperative and supportive of multilateralism as we were before. We didn't really pay attention. We were lulled into thinking this may not happen on a scale we can't manage. So those are some of the reasons I think we've ended up where we've ended up with a much more profound and vast pandemic of COVID-19.
I want to ask you to elaborate a little bit more, if you would, on the frustrations that have come from obstacles to multilateralism. What made it different this time? Why have the nations not come together, as you said, that they have in the past for other global health crises?
Well, I think part of it has to do with, a loss of support and confidence in globalization. And whereas globalization brought many benefits to the world, including to developing countries, and lifted hundreds of millions out of poverty, it also had some side effects which were not managed well, and which have led to, in part, led us to the situation we're in. What am I talking about? Globalization also led to inequality within countries and inequality between countries. And whilst we were lauding the beneficial effects of globalization, we didn't deal with the market failures and with the other side effects of globalization. We could have done more to correct and to make sure that distribution of the benefits of success was more even among the population. the lack of this created a class of people who were losing out. Within the US, middle class incomes stagnated for quite a period of time. People felt that maybe their lives were not moving forward. Their children did not have the same kind of opportunities. And this led to a kind of feeling of nationalism and what can we do for ourselves within several countries. It could be the US, in Britain, it resulted in Brexit and the support for pulling out. And in various other countries, this movement towards nationalism was taking root. So I think that led to this discontent with multilateralism and saying, is this really delivering for us in the end? And I think the answer to that is that perhaps we don't throw the baby out with the bathwater. That globalization can still confer some benefits, but we should most definitely correct for those failures of globalization, and we should not deny them. Otherwise, it will lead to populism and nationalism and some other things that may not be as helpful.
Well, you've been very delicate about not mentioning too much about the American role. US leadership and US institutions, such as the Centers for Disease Control and Prevention, the CDC, have generally been held in high regard in responding to global health crises in the past. How do you assess the US response this time yourself? I mean, when we look at the numbers, 11 north of 11 million cases and almost 250,000 deaths is about 1/5 of the 54 million cases and 1.32 million deaths in the world. That's an outsized percentage, a fifth practically, for a nation that has 4% and is generally recognized for having the toolkit and the leadership to help guide the world through it. What happened?
Well, I can only tell you that I think it's quite astonishing to people outside, I would say, to see the incidence of cases in the US and the number of deaths. And I would hasten to say that the US institutions, such as the Centers for Disease Control and are still held in high esteem. They still are, they're still leaders. And I think they're cooperating with many other international organizations at the scientific level. So that respect is there, but I think you have to look for the political framework as to why perhaps this is what is happening now is happening. And when you have some of the best public health experts in the world. So it's something surprising. I certainly think it's something that the United States can get a hold of and can bring rapidly under control if several common measures are followed. The wearing of masks, the washing of hands, these simple things. At least this can be contained, if not totally done away with. Luckily, we now have 2 vaccines that have come on the scene, the Pfizer and the Moderna. And so we are hopeful that at least that will help to mitigate the situation.
Very good. As we move the discussion toward this issue of vaccines, I want to remind the audience that they can participate in this conversation by sending questions to us, which we will retrieve from our chat box and share with Ngozi. What is the status of the COVID-19 vaccine?
Well, we've all seen what has happened recently, so I need not go into that. But let me tell you from where I sit and what we're doing, something that many may not know about. As you look at this pandemic, it's very important to remember that nationalistic feelings or vaccine nationalism is not going to work because of the nature of COVID-19 and the way it's transmitted. No one is safe until everyone is safe. Because even if you vaccinate all the people in America and you don't look at what is happening elsewhere, you will never feel completely safe. Okay, we have vaccines that are 94% effective, 95, but there's always this outside chance of what will happen. Will it mutate elsewhere and come back? And that is why it's important what we're doing. There's one international effort, one effort at global solidarity in taking care of the needs for vaccines of poor countries as well as rich countries. And it's being done in cooperation with the WHO, CEPI, the Coalition for Epidemic Preparedness Innovation, and Gavi, the organization of which I'm chair of the board, have come together to develop something called the Act Accelerator. They've also come together with major countries all over the world and in Europe. It's an international launch, but the idea is, what can we do to accelerate therapeutics, diagnostics, and vaccines? So it's a little bit like Operation Warp Speed in the US, but on an international level. And the most advanced part of it is what is called the COVAX facility, which looks at how can we get vaccines to both rich and poor countries in an affordable and equitable way for the poor countries. So this facility now has 186 members. 92 of them are poor countries for which we need to raise resources in order to enable them to afford these vaccines. And 94 members are rich, upper middle and middle income and high income countries who can self-finance. They are procuring some of their vaccines through the facility, and in doing so, enable us to come to the volumes that can also diminish costs for poor countries. So this is the only game in town. And we have a portfolio of about 10 vaccines that we are dealing with. And this is good, because it means that if 1 or 2 vaccines don't work, there will be 2 or 3 within the portfolio, and it helps all the countries to avoid risk. We also have the Pfizer and the Moderna and the AstraZeneca as part of our portfolio. And so I think that what we are seeing is a very rapid development. Something that used to take 3 to 5 years is now being done in a year or less. And we will see other attempts, other vaccines coming up very, very soon, I think. So we may have a portfolio of 4 or 5 vaccines at the end of the day that we can all rely on. There's Novavax and a few others that one can talk about. So,
well, if I could, you've raised a number of points in that response that I'm interested in, and I think our viewers will be as well. And first of all, it's the timeline and how quickly that can be sped up, because we're losing lives, we're losing jobs, and other people are just fatigued by the whole experience. And we've been kind of led to believe that it's just around the corner. So the US timeline was 12 to 18 months. And previously, the fastest vaccine development in history was 5 years. So how is it this coalition and the science behind it is different this time? What is likely to be realistic in having a vaccine that will be effective, maybe whether single or double use, and be deliverable all over the world?
Well, thank you. I think we are not just going to have a vaccine, we are going to have several vaccines, because there are scientists all over the world, in Europe, in Australia, in China, in Russia, in different places, as well as the US. You have companies working on this and scientists at a speed we've never experienced. And I think that by the end of 2021, we may well have 3 or 4 or 5 vaccines on the table. Some of them are very costly, others are cheaper. So it will depend on, how many of these we have, how effective are they, have they been certified by the regulatory authorities in countries, and also by the WHO for emergency use. But the timeline is that by the end of next year, we should have 4 or 5 vaccines, even more, that are available. The other thing, though, is delivery. It's one thing to have a manufacture and delivery. Sorry, it's one thing to have the vaccine. It's another to manufacture billions of doses. In the COVAX facility, we are working to have 2 billion doses manufactured by the end of 2021. These things have never been done. So you may have a vaccine that works, but the manufacture of that in enough quantities to go around will take time. And that is why for the whole of the US, for instance, to get access to some of these may take till the middle of next year. And for the rest of the world, may take till middle of next year as well, to the end of next year, simply because manufacturing capability cannot be ramped up as fast as we need. And we may have to get to people in phases. First frontline workers, then the most vulnerable, then, you know, the next segment and the next segment. That's the way I think it's going to go.
That is sobering news because of the timing, and also because of the way the illness and the disease is spread. What, in terms of your financial goals for this, I think it was an $18 billion effort. How since you launched the Global COVAX facility in June, how have you done?
Well, the numbers have changed for one.
Okay.
There was a moving target. So by the time we finished calculations, actually that number was for the whole of the accelerators. It was in the end 32 billion. Okay. For both diagnostics, therapeutics, and vaccines. And we are now at 24 billion. So we've managed to raise several $1 billion. It's not enough. Most of it has been for the vaccines. Mm-hmm. And we've been able to raise 2 billion for vaccines now. For this year, we will need 5 billion next year. And for the therapeutics and diagnostics, we haven't gone too far down the line. So we need to raise much more resources than that. And what we're trying to say is, look, of the 24 billion total left to raise, this is a tiny fraction of the stimulus money. As you know, rich countries have spent about $12 to $14 trillion so far on fiscal stimulus, and more is coming because it simply hasn't been enough. If we can get this 24 billion as part of this stimulus, we can really be effective in trying to get to other countries that don't have the means and the access. And this is what we are saying, you know, let's raise this money from the stimulus, because if we look at aid, it may not be enough. So that's going to come.
Where will it come from? Who's going to pony up?
Everyone. The rich countries, you know, and the poor countries have to pony up too. They don't come into it. They have to put in some co-financing. Remember, the vaccines have to be delivered on the ground. You have to have a cold chain that will take it to the destination and down to where it's needed. So countries have to pitch in too, but they don't have the same fiscal space that rich countries do. So everybody has to work in solidarity and pony up. But rich countries should pony up more.
Absolutely. And you did mention that there is an equity issue on delivery. And given Gavi's record in improving access to lower income countries, what is your take on how these vaccines, this treatment will, and the therapeutics will be delivered with relative equitability?
Yeah. Well, we've seen that some of these vaccines cost quite a bit. You know, some of them promise to be more affordable. Some others, like the two we've just seen recently, are quite expensive. And I think the Moderna is very expensive. So we have to look and see, how can we make this more affordable for the poor countries? And the way we've done this is to create this facility where we have something called the Advanced Market Commitment. We raise money through you know, donors who donate these monies, because they realize that for everyone to be safe, they have to support the other countries. And much of that money is used to purchase doses at reduced prices. Why is it reduced? Because on the other side, the rich countries, 94 of them are also members of this facility. And when we pull the total volume of what this gives, it allows the manufacturers to also give us tiered pricing, which makes it cheaper for the poor countries to be able to access and afford. And so that's the way we are doing it. And we've already had an MOU with AstraZeneca for some hundreds of billions of doses. And we're waiting, we've talked to Pfizer, and we're having conversations with Moderna. So we hope to have at least some doses so that frontline workers in the poor countries can also get access at the same time, and they don't have to stand behind the queue waiting until rich countries have had their own.
Very good. I'm starting to see questions come in, and I'm going to refer to them in just a few minutes. I wanted to turn to Africa in particular, and your home country of Nigeria. You know, as I mentioned at the outset, you in April of this year were appointed African Union Special Envoy on COVID-19, and we have learned and heard a lot about, I don't know how much we've learned, but we've heard a lot about the exemplary responses in South Korea, in Taiwan, and some of the Nordic countries. I'm wondering what you could tell us about how countries in Africa have responded to this pandemic. What lessons have they learned from previous global health crises and pandemic outbreaks to prepare them for this? And if there are any leading countries that would provide examples for the continent overall and elsewhere in the world.
Well, thank you very much. Actually, one of the most interesting things that we see is the fact that the pandemic has not been as severe up to now in Africa as was expected, given the weakness of the health systems. The total number of cases on the continent now is about 1.9 million, so roughly 2 million. And the total number of deaths is about 47,000. And we have many people who have recovered, about 1.6 million have recovered. So the impact on the continent has not been as severe. But I don't think that should make us too sanguine, because it may be that cases are underreported as well, because testing is very limited. We should have, according to the Africa CDC, about 60 million tests by the end of this year, and we have done 12 million by the end of September. So we are way, way behind. But that being said, I think that the incidence of deaths is far lower than what we would expect. So that's one thing, but we need to be vigilant. I think African countries have learned some lessons from what happened with Ebola. And from those lessons, we've been able to do, things like contact tracing, for instance, using the community resources to diffuse information about the pandemic and what to do, the hand washing, the wearing of masks. You'll be really pleased if you go to some of the smallest African countries. Let's take Liberia, for example, where the Ebola hit. When I landed at the airport a few months ago, as you land, you wash your hands. As you enter the terminal, you're made to wash your hands. You wear masks. As you leave the airport, you're washing and cleaning and safeguarding and protecting throughout, because they've learned the lesson. So I'm very proud of some of what we've taken away, that we're practicing that. And I think that is helping very much. I think the second thing is African countries have also acted in solidarity in a way in responding to this, the recognition that, look, going it alone country by country isn't going to work. So let's come together as a continent. And we've done that in great unity. We've developed a platform for the entire continent for medical supplies and equipment, which has enabled us to have better access than we would as individual countries. We've supported the Africa CDC so that the science for us can be front and center. And we've listened to what the CDC has to tell us. So I'm very proud of that. Even the CDC in my own country sends text messages every few minutes telling you the situation, what you need to do, reminding you constantly about hand washing and wearing masks. So let me say, I don't want to oversell it, because I think we still have a ways to go and we should be vigilant. But I'm quite proud of, 44 countries had total or partial lockdowns in the beginning. And I think this was done very courageously and helped to contain the pandemic. Let me end by saying that the economic impact of the pandemic has been quite severe and has set the continent back a decade.
Oh my gosh.
In terms of economic achievements and growth.
Can you talk about Nigeria specifically in that context? both the economic impact and also how Nigeria has done to protect its healthcare workers, the essential workers and the frontline workers in this pandemic?
Well, Nigeria, as you know, is the largest country with almost 200 million people, but we have 64,000 cases and 1,154 deaths. So we've been extremely fortunate. And you know, the president acted promptly also in closing down the country. Actually, it's not long ago that our airports were open. I was stranded here in the US and then in Geneva. I couldn't go home because the airports were not open. So over a long period of time, the lockdowns took place. And I think that has helped us to contain the virus along with the other things I talked about. But you know that in our cities, where we have very crowded conditions, especially in the urban slums, and some don't even have access to the kind of clean water and so on which we need. So I think, as I said, we are very fortunate, and where it was very courageous for the authorities to do what they did. But the other side of that is the economic impact, which has been very severe. And the economy was already a little bit in the doldrums due to the fall in oil price, and was experiencing a recession. It was just, in fact, coming out of recession last year with a growth rate of about 1.2% or so. And then this hit. So the economy will be contracting. It's going to be very difficult. You have seen what happened to oil prices when the epidemic, the pandemic hit. That, coupled with the geopolitical problems between Saudi Arabia and Russia, led to a 60% drop in the oil price between January and March of this year. And that has severely impacted the country. So I think we will have to work very hard to work ourselves out of the contraction this year towards a weak recovery next year.
Very good. I have a question that from Ed Martins in Boston, and it relates to how countries' healthcare systems are strapped in the time of pandemic, and particularly, I imagine, in Africa. There are other communicable diseases like measles. There are non-communicable diseases and ailments that need treating. And when your healthcare systems are stressed, you have this crowding out effect. So the question is, what are you seeing in Nigeria and elsewhere in the continent on that? And from Ed, how close are we to eliminating other things like polio, smallpox, and these non-COVID diseases?
Thank you. That's really an excellent question, because one of the things we learned during the last Ebola crisis in the Democratic Republic of Congo is that twice as many people died from measles as from Ebola. And the reason is, the focus on Ebola took away attention from the regular vaccination campaigns, and you ended up having people dying of measles. So that is a lesson learned, that as much as possible, you also should not forget the other diseases for which you need to continue the routine vaccination. And I can just share with you perhaps a couple of numbers from the Gavi experience. And what we have is that measles and polio campaigns have been badly hit in particular. And measles campaigns were suspended in 27 of the countries that we deal with, polio campaigns in 38, and at least 24 million people in 21 of our Gavi-supported countries are at risk of missing out on vaccines, on vaccination for these diseases. So that gives you an idea that this is really a very important thing. How do we take care of the routine immunization programs whilst continuing to deal with the COVID-19? So in the beginning, everybody was focused on that and forgetting all the other diseases, typhoid, yellow fever, measles, rubella, and so on, polio. I think luckily now countries are coming back. And the fact that health systems are weak, that is also why sometimes it's not it's difficult to manage all of this. Your routine immunization programs, along with new pandemics that may come along. So it's an excellent question. And lessons learned is don't take your eyes off the ball of the routine immunization. Otherwise, you might have even more people dying in your country from those than from the pandemic.
Very good. From the Montana World Affairs Council, why is it consistently more difficult to support and resource disaster preparedness than disaster response? Will the COVID experience change this?
Another excellent question. I really think that the COVID experience, I think and hope that this will change it. I think that the extent to which we are unprepared has shaken most policymakers. And you can see now the movement to even reshore some supply chains and bring them back home for medicines and supplies. They probably will not succeed in reshoring everything, given the intricacies of supply chains. But you see a movement in that direction. Countries trying to manufacture more in their own countries to stockpile more. So I do believe that there'll be more preparedness for the next pandemic. But it's always been, it's been the case before that instead of preventive measures, we sometimes wait until we have to deal with the actual disease, and that costs millions and billions more. Now, that brings me to the point I was trying to make about the COVAX facility, the Act Accelerator, and the need to resource this so that we'll be prepared for the next pandemic and we can respond quickly. It's only $24 billion, but we're having difficulty raising that. But we are prepared to spend billions and trillions down the line. It doesn't make a whole bunch of sense. So we need to reverse that kind of thinking. And I hope that all policymakers in rich and poor countries have taken note.
There's no financial institution, really, is there? There's no repository for an emergency fund for such a thing. But you would think that that might be an international institution that, or is there, under, say, the World Bank or something like that, where there can be this kind of financing?
Well, the World Bank and the IMF and the regional development banks have responded. They've done very well. I would say they were fast. The IMF to Africa has disbursed about, let's say, 26 or so billion by now. The World Bank has disbursed 14, 15 billion, and they're aiming to do more. The World Bank has, in fact, dedicated 160 billion for over the next, I think it's 15 months, to help countries all over the world. So there is some response that is going on, but it is not enough. And that is why, you need to pitch in with other resources. So they can and will respond, but they can only do so as far as their balance sheets will allow them. And as far as the capital that they have underpinning them. And I think they've tried to do that, but it's simply not enough.
Here's a question from the World Affairs Council of San Antonio, Texas. There are many researchers, scientists, and companies working on a vaccine around the globe. What is the incentive for them to work together rather than to be the first to find a vaccine?
Well, thank you. Well, I'm not a scientist, but I will attempt to answer. I think, actually, incidentally, from what we can see, there are many researchers working together across countries and across companies. So some of the efforts you see is not just that one company. You may find that one or two other companies are involved and are actually working on these vaccines together. AstraZeneca, is a case in point, be out of England, where you have, a company working with Oxford University in a collaboration to make this possible. So I think that normally researchers and developers of these would want to, and companies would want to go it alone and make as much money as possible. But I think there's a realization that this is beyond profit. And I actually want to commend some of the pharmaceutical companies that have come together and even come to us and said that they are willing to forgo profit and sell, these vaccines or at a very affordable rate to make sure that people all over the world get access. So we are seeing a change from shareholder concerns to stakeholder. So shareholder capitalism to stakeholder capitalism, where companies realize that their social responsibility is really very important. Now, again, I don't want to oversell that. We've had about 7 companies coming to us in the COVAX facility saying these things, and they're really to be applauded. But of course, there may be others that are rushing for the profit motive. But I'm very, very, what should I say? I'm very comforted by the emerging concerns of these companies for their fellow human beings that I see.
Related to that profit motive, there's a question, not so much what people will do, but maybe what they won't do or what they take away. Mary Mendoza in World Boston notes that Laurie Garrett, the Pulitzer Prize winning journalist on global health, whose book, The Coming Plague, discussed the effects of the profit motive, such as getting rid of hospital beds that weren't being used, was having such a difficult or harmful effect in this crisis. What do you think can accelerate the move toward more social responsibility? Is it going to be people who know people who have died? Is it going to be a millennial awakening? What do you see as shifting the focus?
Well, I think that what will be shifting the focus a bit is just the sheer realization of what has happened now and the lack of preparedness for it on the part of everyone. The policymakers, even the companies and so on and so we were all unprepared, right? Mm-hmm. And I think that fact and the impact of what has happened, this is on a scale that is far different from what we've seen before. And you mentioned the numbers, 55 million cases worldwide, 1.32 million deaths in the US, almost 250,000 deaths now, 11 million cases. These are numbers, someone said 250,000 is a whole city disappearing overnight. So I think that sheer fact will change the consciousness of companies and countries to do better. 2, there's another reason. The COVID-19 virus, the way it's transmitted and spreads, means no one is safe. There's absolutely no way you can retreat into your own country and think I'm done with it. Because, the interconnectedness of the world shows us that we are not safe. And I think this is raising another level of consciousness on the part of companies and on the part of policymakers.
Well, we are likely to be at, 100 9/11s by the end of the year is basically what that number means. Here's a question from Patrick Terrian in Columbus, the Columbus Council of World Affairs. If President-elect Biden were to ask you for advice on what the US could do, what would you tell him?
Well, I would not be so presumptuous to think that I could give this advice, particularly since I'm an economist and not a scientist. So I better fess up quickly, just that I've been in the public health arena. But I would say that, simply I've seen it even on my own continent. So many lives can be saved. So I would say to President-elect Biden that some of what I hear about insisting on wearing masks, at least when you're about to encounter other people, the hand washing, and all those pieces of advice. I know it's very boring. It infringes on what people want to do. I understand all of that. We are all human. But if you can save 1 or 2 lives by just doing those until we can all get vaccines, that's not too much to ask for. So that's what I'll be saying to President Biden. I hear what you have said. I totally support it. I think you should go for it.
Thank you. Parallel to this pandemic, we've had the info pandemic, the spreading of mistrust, disinformation, lack of respect for science, and the like. How do you think that that's going to be restored? And what if you were confronted by that on a massive scale in your next job? What do you think brings that back under control?
Well,
prosperity?
Not really. It could help, but not that. I mean, it's unfortunate that the internet and social media is such that some of these things are very difficult to control. And I'm on the board of Twitter, and we've been making strong efforts to deal with misinformation of all sorts. And you can see the anti-vax movement on social media and the strength that that has. I think this is partly also fueled by lack of trust in leaders. If you see opinion polls or recent surveys all over the world about what people think of their leaders, of institutions, the level of trust is very low in politicians. Level of trust in leaders in many countries is low. So to me, in order to convince people about what is real, important information, you need to rebuild trust. You need to get behind science. You need to take some, you can see that some scientists are trusted by the majority of the population. So if they come out and say something, people listen to them. So I would get behind those people in order to try and rebuild trust. And, place the truth in front of people. You can see in New Zealand, for instance, right, where Jacinda Ardern, they practically have no cases now. She's built the trust, her people trust her. So when she comes out and says, do X, they actually believe what she's saying will work. And they do it, even though it's also another country with democracy and freedoms. You've seen, some 2 or 3 of the Scandinavian countries. You've seen South Korea, you've seen Germany. Actually, many of these countries
all led by women.
Are led by women. We don't have enough data to say that when women lead, you automatically do better. But this is anecdotal data that all these countries are led by. And I think what they have in common is that they have the trust of their population. And to answer your question, it is not going to be easy to get rid of this overnight. We will have to work hard to rebuild trust so that when leaders come up and say X, people will believe it and do it.
Well, let's talk about female leadership. As I mentioned, you're one of 2 finalists to become the next Director General of the World Trade Organization. And what can you say about the support of your nomination and the importance of having a woman of color in that role, leading the WTO?
Actually, I want to make a correction. There were 2 finalists, but at the end of the competition, one of them came out tops as the person likely to win the most consensus to be DG.
That's you.
And that's yours truly. But of course I was blocked. The US did not join the consensus. So that is why it has not been finalized. But the GATT, General Agreement on Tariffs and Trade, that preceded the WTO, has been led by men for the 75 or so years. It's been in 70-something years. And if you add 25 years of WTO, it means that for 75 years on international trade issues, men have had the leadership. Now, I believe that God distributed talents, brains, and leadership qualities equally. I do believe that. So there's absolutely no reason why women could not have been in these positions. So it's quite exciting, the fact that a woman, 2 women were finalists, and a woman of color is coming out. But let me say one thing. I strongly believe that for these organizations, especially the WTO that has so many problems, you should look for a leader that will solve the problems. First and foremost is the merit. Who merits it? Who has the qualities? When you have an organization in trouble, you need to look for those who are actually able to lead the organization out of trouble. And if that happens to be a woman, fantastic. And it happens to be a person of color, why not? Or an African. And so that's the way I came at it. Who has what it takes? And since I've been fortunate, and I'm also a woman of color, an African, and a woman, it will be fantastic if I get to do the job for the world.
Have you thought about your priorities?
Absolutely, absolutely. I think
you're facing America first, or the consequences of it. You're facing rising protectionism and populism elsewhere, very complex trade issues from data, digital-driven regulatory issues and so forth. What do you see on the horizon there?
You've laid out some of the very complex problems that the WTO confronts. And I could tell you many more. But I think I want to say one thing before I tell you my priorities, something I repeated this morning at a talk in the Peterson Institute. When you look at what is happening with the WTO, and I've talked to over 130 ambassadors and 70 ministers in countries. So I have a pretty good idea of what is wrong. One is that lack of a sense of purpose. The WTO has lost its purpose, and we need to bring it back to people. Why is it there? Why is trade important? And why is the WTO the rules that make for predictability, stability, and fairness? Why is that important? It's because we need to serve people. The preamble to the document that created the WTO talked about its purpose is to improve living standards, raise incomes, create employment, support sustainable development. That has been lost sight of. And so one of my top priorities is to bring the WTO back to the purpose for which it was created, and to help it work with other organizations and not the siloed approach that is taken now. The other is trust. Trust has been lost between members, be it between US and China, US and EU, between developing and developed countries. And we have to restore that as well. Now, that being said, I think we need some wins that every member can participate in to build trust. So we have an ongoing multilateral negotiations for fisheries subsidies, which deals with the sustainability of our oceans, of our fisheries in our oceans, which is a very good thing. And if we can finish negotiating this issue of the subsidies around the fisheries and feed into the sustainability in the Sustainable Development Goals number 14.6, this would be great. So that's a top priority for me. That would be a success. The second will be dealing with the COVID-19 issue. It's a very, very, the WTO should seize the moment to work with the WHO to see how trade can be part of the solution. After all, medical supplies and equipment are traded. Vaccines will be traded. What are the rules either in place that could be enhanced, or the new rules to be created that could lead to accessibility and affordability for these vaccines and for other type of medicines to deal with COVID-19? How can trade contribute to a recovery of the globe? These are some of the things I think are top priority now. How do we build resilience within the trade framework for the next pandemic? I think this is important. I mean, third is restoring the appellate body, which has been in dysfunction. This is the only place in the world where nations that have trade disputes with each other can come to have their disputes settled and arbitrated. So you remember the trade wars of centuries past. We don't want to replicate that. We actually have a place, but it's dysfunctional now because it's been blocked, and we need to reform it. and bring it back to life. I'll mention just one more. You talked about e-commerce. It's clear we are in the digital economy. It's here to stay. It was there before the pandemic. The pandemic has accelerated it. And within this is the issue of e-commerce. The WTO rules that should underpin e-commerce are not yet in place. So we need to work really hard to upgrade the rule book to underpin this, because this is the way the world is going. So these are some top priorities. And I should include doing something on inclusion, about women in trade, about micro, medium, and small enterprises, and bringing rules that could include them within the benefits of trade and the WTO.
Well, as you and I mentioned, discussed when we were talking before the program began, there's an opportunity, I think, for World Affairs Councils to work with you and the World Trade Organization to highlight these issues to Americans so that they understand the power of multilateralism and the necessity to have such a body to work with. Dr. Ngozi Okonjo-Iweala, this has been a fabulous discussion. We're so pleased to have this opportunity to spend an hour with you, especially at this time when you've been very busy globetrotting to Geneva, and I know you had thought about going to your home country of Nigeria this weekend, but have stayed here with us. Humbly, we normally are convening in the Mayflower Hotel with hundreds of people in the audience who would applaud your honor and all that you have done. And specifically at this time, we thought it very important to honor you. A year ago, we presented the inaugural WACA International Service Award to James A. Baker III, the Secretary of State, for his work, his career work. For you, this is really the power of now. You have a remarkable career in finance and development, but this year you've done so much as chair of Gavi to use your network to bring together leaders to build that global COVAX facility, that initiative that will fund vaccines. You've done so much over the time that you've been on the board as chair from 2016 until the end of next month to highlight the importance of immunization as a way to prevent disease and to save lives by providing funds and thought leadership to get children vaccinated against disease so that they can live safe, healthy, and productive lives. So humbly, this will be sent to you. It's a model, it's a miniature of the award, the WACA 2020 International Service Award, that we gladly present to you, Dr. Ngozi Okonjo-Iweala. Let me give you my round of applause.
Thank you.
I shake your hand or give you an elbow at a time of COVID.
Yeah.
And I really hope that once you get installed in your new position, where you'll have really significant influence on global events, once again, that you will spend time checking in with us whenever your busy schedule would allow, because we'd love to continue the conversation. Thank you very much for being with us tonight.
Well, thank you so much, Bill. I'm thrilled and I'm honored. I'm following in big shoes from Secretary Baker that you awarded last year. And I am discovering WACA more and more, and it's doing amazing work. I'm particularly taken by the work you're doing with youth. And this is something that would be immensely interesting to me, should I end up with the WTO DG, to be able to work with you, to indeed bring the WTO home to the youth. I also saw you won a Diversity and Inclusion Award in 2014.
Yes,
and I want to say that in these days when we're dealing with issues of diversity, that you won such an award is amazing. And I want to congratulate you for all the work you do, and to thank you most sincerely for trying to bring such important topics to people in the United States. This is amazing. There are not too many places that do this and reach down to youth and reach widely all over the US. So thank you so much. I look forward to working with you. I'm thrilled with the award. I feel very humble. And this will be one placed in a favorite place when I eventually get it, where I can look on it every day. Thank you so much.
Thank you. We look forward to seeing a picture of you with it, which we will share with our network. And we would, again, as I say, love to collaborate with you going forward. Again, on behalf of the World Affairs Councils of America Board of Directors, I want to thank you, Gavi. I want to thank all our sponsors for making this event possible and for this entire week of new frontiers in diplomacy and national security. I want every one of you to be safe and inspired and ready to go tomorrow. We have another set of programs. 2 o'clock begins our next think tank program with the Quincy Institute for Responsible Statecraft. That will be a special briefing to which anybody in this audience is invited. And then after a leadership meeting in the afternoon at 4 to 5 o'clock, we will return at 7 o'clock to have a conversation with Lieutenant Colonel Alexander Vindman, who you all know was a key witness in the impeachment trial. And he was a former National Security Council aide on European and Russian affairs who is coming out with a new book, Here, Right Matters. Indeed it does. Thank you again, everybody, for joining us this evening. Good luck to you, Ngozi. We want to see you again, and good night. Be safe.
Good night, Bill. Thank you. Thank you, everybody. Thank you.